IHCA seeks to put crisis in health sector at heart of election debate. There are currently over 500 unfilled permanent hospital consultant posts right across Ireland's public hospitals, according to the Irish Hospital Consultants Association. The IHCA has met with Minister for Health, Simon Harris, to outline the main factors contributing to the trolley crisis, waiting times for patients and other key pressures upon services which are impacting upon hospital staff as well as upon patient outcomes. At the meeting earlier this week with Mr. Harris, the IHCA urged Fine Gael, as part of its election pledges, to commit to a selection of goals to ease the health sector's current crisis, namely a commitment to open 800 public hospital beds within 2 years and fast-track an additional 2,600 hospital beds by the end of 2025, to commit to creating resources needed to deliver a maximum waiting time of 4 hours for patients presenting at emergency departments to be admitted to an inpatient bed if needed, discharged home or transferred to an appropriate service, to commit to creating resources needed to deliver a maximum waiting time of 18 weeks following a GP referral for a consultant outpatient appointment, and for inpatient/day case public hospital treatment, to commit to ending a failed government policy of consultant pay discrimination that has caused 500 unfilled permanent consultant posts and added to the misery of 1 million people waiting for treatment and hundreds languishing on trolleys. dailyIHCA President Dr Donal O'Hanlon, at our meeting, frontline hospital consultants appealed to Minister Harris to put politics aside and patients first, by fully committing to effective targets to deliver timely care to patients which at least match those in the NHS. The delivery of effective targets will require the implementation of practical workable solutions that the IHCA has recommended for years, he said. The first requirement to provide timely care to the 1 million people on public hospital waiting lists and the hundreds of patients being treated on trolleys each day is to recruit and retain a sufficient number of permanent hospital consultants. More than anything else, we need to fill the current 500 unfilled permanent hospital consultant posts caused by the government's discrimination against new consultants. The discrimination and the consequent consultant shortages are the main contributory factors behind the 1 million people now waiting for hospital treatment and the hundreds of patients languishing on hospital trolleys each day. Getting highly trained specialist consultants back working in our public hospitals will ensure that hospital patients are treated without unacceptable delays. Fine Gael's election campaign urges the Irish public to look forward, but without decisive action now to attract hospital consultants into our health survey. For more on this story, visit the news article link.